The number of guests allowed to attend a wedding ceremony has now been reduced to 50. The Interfaith Council also announced that the number of those attending funerals will remain at 100, but only 15 will be allowed at the graveside. This as the number of COVID-19 total infections crossed the 80,000 mark, with 780 new cases reported and 10 more deaths.
The new measures announced after deliberations with the Ministry of Health has been occasioned by the rising number of COVID-19 infections in Kenya, especially in the month of November.
As a council,
Reverend Connie Kivuti, the vice chairperson of the council, says that all the current requirements of hand washing or sanitization stations will have to be observed during all social gatherings, including weddings, church services and funerals.
We urge religious leaders and all of us to be our brothers and sisters keepers by adhering strictly to the guidelines as we protect ourselves and our loved ones. Let us observe the guidelines as given by the Ministry of Health of hand washing, social distance, and wearing of masks.
The announcement coming as the COVID-19 cases continue to soar, with 780 new infections recorded in the last 24 hours. Total infections in the country now surpassing the 80,000 mark. So far, 861,561 samples have been collected since March. 10 deaths have also been recorded in the last 24 hours, bringing the total number of deaths to 1,427. 552 patients have recovered, bringing to 53,526 the number of patients who have recovered from the virus. 1,232 patients are still admitted in hospital, with 57 being in the ICU. But even as the country continues to record high deaths and soaring numbers in infections, little seems to be done in ending the looming health workers' strike. Appearing before the Senate Health Committee to answer to questions on counties' preparedness on combating COVID-19, Council of Governors Labour and Human Resource Committee Chairperson James Ongwae told the team that governors are helpless in meeting the doctors' demands.
If you look at our own hospitals, in terms of their getting resources for their daily operations, for operations and maintenance, it is a very big problem that we have, because we have not had resources at all. In fact, what Senate needs to ask is, if we have not had resources for the last 3 months, how do our hospitals operate?
Ongwae saying the delay in disbursement of funds to the counties has not only hampered efforts that have been put in place to combat COVID-19, but made it impossible for the devolved units to pay the striking health workers.
We would also want to recruit even more personnel, but how do you recruit personnel if the few that you have, you are actually paying them through a bank loan? Why do I think that there could be a problem of availability of resources in this country? As a governor, I am under extreme pressure. I don't want my people to go on a strike. Nobody wants to see those strikes.
Health workers had issued a 21-day notice, which is lapsing on December 7th, to have their demands met or they down their tools.